We are coming to the last few slides. What are the practical tips for diagnosis? You are just about to start your journey as a doctor. In another year, you'll be full-blown doctor and you'll be treating patients on your own. And so you should have some practical tips in your mind. Number one, use your brain. Don't use your spine. Don't go for spinal reflexes. I've seen too many spinal reflexes happening in even teaching medical colleges, which is a pain. What are the spinal reflexes? Patient का hemoglobin कम है, आयरन शुरू कर दो. अरे भाई रुक जाओ. ये hemolytic anemia है, ये थैलासीमिया है, क्या चीज़ है? तो डायग्नोस तो करो. अभी कहाँ से कूद रहे हो? सिमिलरली TLC DLC बढ़ा हुआ, अरे यार इसको तो इन्फेक्शन है, एंटीबायोटिक शुरू करो. अरे भाई रुक जाओ. कितनी इम्यूनोलॉजिकल डिसऑर्डर्स हैं जिसमें हाई TLC DLC होता है, जिसमें एंटीबायोटिक नहीं देनी. एंटीबायोटिक तो कुछ हो ही नहीं रहा. So you have to think. Don't become a spinal doctor. If you have become a spinal doctor, please change. It is very difficult to unlearn and change your habits. But you have to unlearn, change your habits. This is the worst kind of habit I have seen in doctors. If you are not certain about a diagnosis, admit it. मरीज आपसे पूछेगा जी क्या बीमारी है, हमें नहीं पता क्या बीमारी. We are trying to investigate. ये है. It is so difficult to diagnose even a viral fever. Right? टेस्ट हैं, लेकिन टेस्ट की अपनी लिमिटेशन है, कॉस्ट है, सब कुछ है. Right? So, admit that we are investigating, we will reach a diagnosis, and these are the possibilities we are thinking, but we are not near the diagnosis. Right? So, we got to admit it. Because this admission is not as much as to the patient but to yourself also. नहीं तो आप एक false sense of security में पहुंच जाओगे कि इस मरीज की diagnosis हो गई. Now I can lay back. And if you are treating empirically, monitor and be ready to change. हम बहुत बार empirically treat करते हैं. I give you an example. This is one of the worst cases I have handled, and this was a lady, about 50-year-old lady, came with cough, hemoptysis, and this is about 30 years back when Meerut did not have a CT scan. So we got an X-ray chest. There were both upper zone shadows. We got twice or thrice repeated sputum AFB done, which was negative. But then I said, okay, many of the time we don't get sputum positive, so I'm going to treat you as tuberculosis because you are a non-smoker and you have both upper zone changes. Let's treat you with. We started her on tubercular treatment. She improved a little bit, but after 1 month started having hemoptysis again. This is the time. So if you write a diagnosis of pulmonary tuberculosis on your prescription, please write query. That keeps reminding you that you are not certain. And luckily I had a query at that place. And when she did not improve, I said, get a CT scan done. And CT scan was done, and she was found out to be CT scan was done in Delhi, bronchoalveolar carcinoma, a rare case, rare presentation, a non-smoker person. But body, you are at the mercy of God, you are at the mercy of diseases. You know, any antibiotic, any drug can give rise to Stevens-Johnson syndrome. There are a list of, if you are unfortunate, and in the very first month of you have a Stevens-Johnson syndrome, you're gone. You should actually leave that place and go to somewhere else to practice, because that's the end of your career. That case will die or do something, and it will keep on clinging to your name. So you got to be very, very lucky to it is extremely important to know uncommon presentation of common diseases than common presentation of uncommon diseases. Very, very important. Because tuberculosis कैसे कैसे present कर सकती है, treatable है, आपको सब पता होना चाहिए. स्किन की ट्यूबरक्लोसिस कैसे होती है, जॉइंट की कैसे होती है, लिम्फ नोड की कैसे होती है, एब्डोमिनल ट्यूबरक्लोसिस, जेनिटो यूरिनरी ट्यूबरक्लोसिस कैसी होती है, ब्रेन की कैसे होती है, मेनिंजाइटिस में क्या होता है, ये सब पता होना चाहिए। आपको अगर कोई रेयर चीज़ें नहीं भी पता तो नहीं पता, बिकॉज आजकल तो इतने ज़्यादा रेयर सिंड्रोम्स हैं, सब याद रखने इम्पॉसिबल। अगेन आई कम बैक टू शेरलॉक होम्स whom I started। अगर कहीं डायग्नोसिस नहीं हो रही है तो आपके पास लिस्ट होनी चाहिए डिफरेंशियल डायग्नोसिस की, एंड देन यू स्टार्ट कैंसलिंग उनमें से कौन कौन के आपने टेस्ट कर दिए, और जो बचेगा वही सच है, राइट, कितना भी इम्प्रोवेबल हो। एंड लास्ट बट नॉट द लीस्ट इज दिस, we are what we repeatedly do, thus excellence is not an act but a habit। होता क्या है कि हम कॉर्नर कट करते रहते हैं, मरीज पुअर है, अफोर्ड नहीं कर सकता, हम ये नहीं टेस्ट करा सकते, हम वो नहीं टेस्ट करा सकते, यार then you will forget as to how should you treat a disease ideally, वो भूल ही जाएगा। To give you an example, a patient came to me with diabetic ketoacidosis. She was very rich person from Meerut. We got her admitted and she says, her husband came and said, Doctor, we can afford everything. You should get her treated like it should be treated. Don't worry about money. And I had totally forgotten by that time how frequently should I do blood pH. Should I do it 4 hourly or should I do 2 hourly? बिकॉज हम तो एक बार करके रुक जाते थे क्योंकि पैसे नहीं होते थे मरीजों के पास, राइट। सो देन आई वेंट बैक टू बुक, नो हार्म इन डूइंग दैट, गोइंग बैक टू बुक इज नो हार्म, एंड देन ऑफ कोर्स डिड इट। दिस इज व्हाट आई हैव बीन डूइंग इन। सो देन आई रियलाइज दैट व्हेनेवर वी राइट अ प्रेस्क्रिप्शन वी शुड राइट अ आइडियल प्रेस्क्रिप्शन। अगर उसमें एमआरआई होना तो होना, चाहे पेशेंट करवा सके या ना करवा सके, इट्स हिज, आप लिख दो उसमें दैट यू नीड एन एमआरआई। वो नहीं करा सकता, ठीक है, वी आर ट्रीटिंग, बट आई नो दैट शी नीडेड एन एमआरआई। क्योंकि अगर हमने लिखना भूल गए तो हम बिल्कुल ही भूल जाएंगे, बिकॉज हम लोगों की प्रैक्टिस ही गलत हो गई। तो ये मत सोचना कि जब एग्ज़ाम होगा तो उसमें मैं बढ़िया तरीके से डायग्नोसिस करूँगी। नो नो, every time you see a patient, see it as if it's your exam। आपने क्या डायग्नोसिस बनाई, और जब आपने डायग्नोसिस बनाई उसके सपोर्टिंग एविडेंसेस क्या 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 हैं। वो आपने अगर rheumatic mitral stenosis with atrial fibrillation with congestive heart failure की बनाई, so what are the things which is supporting rheumatic, what are the things which is supporting mitral stenosis, what are the things which is supporting atrial fibrillation, what are the things which is supporting congestive heart failure. Have a very clear view of that. And so when you do that as a routine practice every time, you're going to become a very, very better person, and you will have an amazing, successful practice. I think, thank you very much.